In this parking lot outside of Minneapolis, Abigail and Annette are exchanging insulin.
That came from Canada.
A black market of sorts for the diabetes medication, which in the U.S. can cost hundreds of dollars a month, even with insurance.
Really appreciate it. Thank you. I rely on donations all the time for my insulin. I can't afford it. I don't go to the pharmacy for insulin at all.
So stretching would be
Like Annette, Abigail has type 1 diabetes, a lifelong condition that requires insulin injections multiple times a day. She and her husband decided not to pay the pricey monthly premium for insurance. Instead, she uses insulin from diabetics around Minneapolis willing to spare their extra medication. And sometimes she distributes it to others in need.
we're not poor. I mean, when we're forced to pay for it, it definitely puts us in that, below poverty level simply because we're trying to afford the medication. Right now, I have enough, but my entire adult life I've gone in and out of rationing my insulin.
Rationing is when diabetics take less insulin than prescribed in order to make the prescriptions last longer. Endocrinologist Sarah Boo Malham says the practice is common but deadly.
For a type 1 diabetic, if you miss one day of your background insulin, you can start developing those ketones and you can get into diabetic ketoacidosis. So you don't have days sometimes.
Nicole Holt says her son Alec was rationing his insulin when he passed away in 2017. At 26 years old, Alec was no longer eligible for his parents' insurance and couldn't afford any on his own. He'd been off insurance for less than a month when he was found dead from diabetic ketone acidosis. In the wake of his death, Nicole has become an activist in the fight for lower healthcare and prescription drug costs. Aside from her advocacy, she is also one of the biggest collectors of insulin donations in Minnesota. Her basement fridge holds roughly $50,000 worth of insulin, which she gives to people like Abigail to distribute.
It is not legal. It is absolutely illegal what I'm doing. And, at times I am concerned that I could be charged with a crime. But I think what I'm doing, it's saving people's lives, and I think that's more important.
Partially used.
Farther north, some diabetics like Travis rely on another option entirely. He crosses the border into Canada 4 times a year to purchase insulin for a fraction of the price. These 2 vials contain the same amount of insulin made by the same brand. The American version costs $345. The Canadian version is $25.
I refuse to pay into that system. And if I had to backpack it through the boundary waters in a canoe with insulin in a backpack, I would. I just will not pay what they're asking.
As insulin prices continue to rise, eyes are on the 2020 election, where candidates like Bernie Sanders and Elizabeth Warren have made affordable health care and lower prescription drug costs a main campaign platform.